Assalamu alaikum, Dr. Hussain Bashkolachi YouTube channel से today we are just giving the concept of how to read a community medicine subject. Community medicine subject was introduced by the Royal College of Physician Surgeons, UK in early 70s by perhaps 74, because the doctors at that time were mostly the GPs or the full-time working in the community hospitals, and other setups are were not, and even the technology at that time was not so vast as it is today. Even this online and internet facilities were not there. So community was the part of the entire practice, and that medical practice was around the general physician, or we call it GPs, or medical officers, and they were part and parcel of the community. They started their practice, established their clinic, and the patient and clientele or the users of the clinic were just known, and doctor was just part of that social strata, and participating in their marriages, looking after their family houses. Even the home visit was part of the uh, community medicine, and then it was more specialized form called family medicine, and then preventive and social medicine also was part of this, and now research is important component of the community medicine, and environmental health and use of the health technologies, as well as the rapid and the advanced testing services, or rapid test for malaria, rapid test even was established, developed by the laboratory system for the COVID. And there are many other daycare facilities, and then there was a primary, secondary, tertiary concept. So primary and perhaps most of the diseases of the secondaries were part of the community medicine. And now in the TED talk, it is said that community is medicine. As you can prevent diseases by taking medicine, then by taking actions at the community level can also stop the diseases, whether they are minor, infectious, or even the major or non-communicable diseases. So today I used one of the app to develop this presentation. So I declare that I don't have any big interest or my own conflict of interest. So let us start by sharing what is the presentation saying to about this topic, that how you can study a community medicine while you are a MBBS undergraduate student. So with this, you can see that the presentation is there, and how to study community medicine in the MBBS curriculum. This will benefit directly to the new batches, senior batches, and even in the different courses. Community medicine is part of the nursing, community medicine is part of the BS program in public health, and even the research is part of every kind of public health, medicine, surgery. So this topic will help and will encompass. And even I was today looking that concierge practice, or concierge medicine and concierge doctor, in which the patients become the member of the group of that doctor, and a very personalized and very hassle free and 24/7 hours contact with the doctors, and even their lab and other surgeries, they are decided by the concierge surgeon. And that is another version or upgraded version of the community medicine, you can say, or the healthcare delivery system. So let us move further, and you can see that how community medicine is a group or a teamwork. You can see the doctor, you can see the nurses, you can see the community workers, you can also see the paramedics, and some of the linkage with referral system. So let us move to this. Understanding the challenges, early introduction. Community medicine is a, let us have a full. So community medicine is often introduced early alongside foundational subjects like anatomy, physiology, and biochemistry, which can be overwhelming or just overburdening you, but it is not the case. You will learn more. And then balancing demands. Students frequently struggle to balance the extensive theoretical knowledge with practical sessions and crucial field visits. Field visits are basically the real situations of the community in which they will do a survey, ask questions, and see the patient at the early stage of the disease. While in the hospitals, it is the late form of the disease. But in the community medicine, you can see very early. Suppose a person is having a diarrhea, then still he will say that I have just started this. But when he will reach the hospital, already dehydration and other complications are there. Even for malaria, it can be the starting of the fever, body ache, but then it will be a very high grade fever when he will reach the hospital. Then the strategic approach, mastering this subject requires a strategic, consistent, and proactive approach. Proactive means you are always active, not reactive. You are with the intention of learning, ideally beginning from the second professional year of the uh, so then start smart, build a daily habit. That is the slogan of the community medicine. Dedicate 30 to 60 minutes daily. Please mind it. The students who are now studying in MBBS, even my university as a teacher and professor of community medicine, and the fellow of College of Surgeon. So I will emphasize that dedicate 30 to 60 minutes daily to community medicine for your second professional year onward to build a strong foundation. Begin with the core chapters such as concept in health and disease, utilizing recommended textbook like Park, and in Pakistan we are recommending the Ilyas and Ansari book, and even we have Samina Afzal and other authors are also there, and Paramount books, they have also published a public health in which my chapter is also given. So there are other books also in the community medicine as Oxford textbook of public health, and even there are many Indian authors, particularly K. Park is very popular in Pakistan and India. Actively attending lectures enhance comprehension and makes subsequent textbook reading more accessible and meaningful. Then coming to the resources, epidemiology is the core subject, and biostatics also. And biostatics will say that it is the eyes and ears of the community medicine or even of every field. So, epidemiology made easy and some nutritional policies, national data, but I will recommend that in the context of Pakistan, the Ilyas and Ansari book is the very earliest and very important book that can be, and another is Zulfikar Sheikh book of community medicine and public health, and we have latest publications from Paramount and others. So national data is also important. Then practical session and field visits and your exam game is changer. Make it a priority to attend all practical classes and community health visits. Community health visit is part you can see in the picture also. It is not hospital, it is the village, it is the community, it is the Kachi Abadi. You can see the hills, the trees, and how the houses and health you can see very close and very in a real situation, and you can talk to the community that will improve your interpersonal skills, cultural skills, as well as your understanding of the health and environment together at the same time. You can see even the water sources and waterborne diseases, their burden in that community. Prepare for visit by reading relevant topics the day before to better understand and interpret observation in the field. Document your findings meticulously. Take photos or sketch you can of your observation for future exam review and practical application. Then, yes, we have already covered this and collect the past papers, prepare and short notes. Papers and short notes is important. You can see here in the picture how the short notes can be on your book and diary journal. We are also recommending the logbook as well as a journal in which you will write the field visits as well as assignments and some of the practicals in the laboratory. Suppose we have lux meter as well as we have noise meter, and we have how to prepare ORS and how various family planning methods, vaccine tray, and even the hand washing station. Gather 10 years of question papers from annual, supplementary, and pre-professional exams to understand common themes. If you are unable, at least get 3 years to 4 years questions. Identify key questions. Analyze past paper to identify frequent questions. Paper short notes. Develop concise short notes. So with this, I think we are reaching these are the textbooks, online lectures, practical manuals, and then we can have a communication skill. Community medicine extends beyond statistics to encompass crucial aspects like doctor-patient relationship, health education, and effective communication. Engage actively with attitude, ethics, and communication. And short form is EATCOM, ATCOM, attitude, ethics, and communication. ET means ethics and practical, both verbal and non-verbal communication. You can see that how important is the verbal and humble communication. As I am also using this tool, it is part of the communication. Technology, current policies, follow the latest national health policies, and books, apps, leverage mobile application, e-books, and MCQ and memory aids for quick and effective study group. Join study groups, online forums to discuss complex topics, clarify doubts, and share insight. And then curiosity and confidence, which is important. So consistency is the key. Regular study through your MBBS years is far more effective than last minute cramming. Pace yourself for sustained learning. Build confidence, cultivate curiosity, connect theoretical concept to real world community health issues to deepen your understanding and making. Best luck on your journey to mastering community medicine. With this, Dr. Hussain Bashkolachi is saying thank you. And if you have learned how to study community medicine, then I think this video is for you. Please share it. And if you have learned, drop a comment and also write your country or city and anything which you want to learn, let me know. Thank you very much, Professor Hussain Bashkolachi YouTube channel link is there. Please press the button and share and also share in your groups and WhatsApp groups. So thank you very much. With this, I think once again we are going to our final words. So community medicine basically is a social medicine, is a part of the community, and it is art and science of technical knowledge, application of technical knowledge in order to improve the health of the community through the health team. It combines social, medical, as well as the environmental sciences and research together, and it makes a combination of the foundation of the community medicine. Epidemiology, biostatics are the core subject here, but the health planning and research is also there. So with this, I think thank you very much for sparing your time and paying attention. Uh, so with this, I think we are ending this meeting.